We are back with another episode of the Erectile Dysfunction Radio Podcast. Today we are joined by Dr. Elliot Justin. Dr. Justin is the founder and CEO of FirmTech, a wearable device company in the men's sexual health and erection space. He is a medical doctor who has been involved in medical startups in the technology space for several decades. He has been a force in questioning and challenging the status quo and striving for better understanding of and interventions for various medical conditions. We're very, very excited to have Dr. Justin on this episode so he can talk to us about erectile dysfunction and how wearables can help us better understand and treat this condition. So, Dr. Justin, thank you very much for being with us.
Thank you, Mark. It's great to be here.
Okay, so to get us started, can you just share with our listeners a little bit about what is wearable technology?
Wearable technology are medical devices, diagnostic aids, or actual diagnostics that are worn. They can be worn on the body. They can be worn in clothing, and they give people information about their health status. And they can range. They're being used right now to treat migraines, to treat seizures, to treat diabetes. But the most common ones are the wearables that people have, smartwatches, smart rings that people have.
Okay, the feedback that they get on a device like a smartwatch or things like people monitor their sleep, heart rate, various other types of things. These are examples of wearable technology?
That's correct. But in the area that you and I want to discuss today, what do men care more about? How many steps they took yesterday? Whether they gained 2 pounds on their digital scale, or their favorite organ, the vital signs of their favorite organ.
Yeah, so coming right to that, so there are many areas of wearables that are being developed to assess people's sleep, general health, all kinds of diseases. How did you come to focus on wearables in the sexual health space?
Well, back in 2015. Well, let me just preface that by saying I live in Montana and I own horses. And sometimes when I'm riding fast, I have the delusion that I'm a centaur, that I'm one with my horse. So back in 2015, riding rather recklessly down a forested trail that I'd never ridden down before, there was someone, a well-intentioned person had cut a tree such that you could walk underneath it, but you couldn't ride a horse underneath it, especially if you're going about 35 plus miles per hour. So I broke 6 ribs and 6 vertebrae. And there's something that there's a diagnostic sign. Mark, I never heard of it. I call it the cock-up sign. I called it that in 1982, and it hasn't really caught on very much, but I'm passing it on to your viewers because every man, practically every woman, should know about it. So I was lying on the ground, and the first thing I did was cock back my big toe. If you cock your big toe back, you'll be able to urinate, defecate, and fornicate. Then I got to the ABCs afterwards, and that was all okay. So I was in a lot of pain, and as I was recovering, I became interested in what's gone on to help men who have significant erectile dysfunction, whether from trauma, multiple sclerosis, or other diseases. What's gone on since I was in medical school other than the Viagra-type medications, so-called PT5 medications? Turned out not much, but there were 5 urologists around the world who claimed in peer-reviewed papers that they were able to produce erections in men with multiple sclerosis, trauma, and other major problems by what we call in medicine neuromodulating the cavernous nerve. The cavernous nerve is everyone's favorite nerve that no one's heard about, which is the nerve that is responsible for producing orgasms in men and women. And neuromodulation is like cardiac pacemaking. It's been around since the 1960s. So my thought was, can we pace the cavernous nerve to rehabilitate sexual performance, but also to maintain sexual performance as we age? Mm-hmm. I experimented on 2 rams, male sheep. We called it ram charging, and we got erection and ejaculation in the sheep, but we also got defecation and urination, so it wasn't exactly bedroom friendly. Okay. So I then, working with 2 of my friends who are research urologists in California, I had them implant an electrode by my cavernous nerve, and the end result was nothing. But because of that work that I put out on my LinkedIn, I got contacted by a research urologist at the University of Utah who was interested in coming up with a device to count the number of nocturnal erections that men have. Many people aren't aware of it, but men have more than just their morning wood, so to speak. They have other erections during the night. So a man my age, I'm 69, should have 3+. Mark is kind of younger, maybe you have 4, but a young man, in a young man in his 20s or 30s will have 5 to 6. Mm-hmm. If you could follow a trend of those nocturnal erections, we could see that a downward trend is a sign of significant vascular disease. The 2 organs in the body that are most sensitive to vascular disease, speaking about diabetes, hypertension, atherosclerosis, which are the big ones. If the 2 organs of the body that are most sensitive to those changes are the retina and the penis. Before you'll see diabetic changes on a blood test, or before your blood pressure goes up significantly, you'll either get erectile dysfunction and/or you'll see changes in the retina. Now it's really hard to check out your retina at home. Mm-hmm. So I want to come up with a way of giving people the equivalent of an electrocardiogram stress test for their penis at home in privacy without appointments, just the way people that have wearables that are giving them data.
Okay, it's really, really fascinating. But it sounds like you already were working on things in the sexual health space that kind of led you to this wearable device for erections. Now, can you share with our listeners a little bit more about some of the applications for this device in particular?
Certainly. I can talk about the parameters first. I think that might be more informative. So we're measuring. What are we actually measuring? Worn overnight, our tech ring can count the number of nocturnal erections that are indicative of vascular health. Worn during sex, we measure the duration of the erection, the firmness of the erection, and the number of ejaculatory contractions. Mm-hmm. So the two of the most common conditions afflicting men with sexual performance problems are psychogenic ED, which is that men have erections while they're sleeping, but they can't perform with someone. Right now, there's no way to diagnose this. So our device is valuable sort of at both ends of that, if you will, because if a man is having nocturnal erections but not performing in bed with a partner, there's probably something wrong with the relationship. Or, it could be other factors, alcohol, drugs, et cetera, but there's probably something wrong in the relationship. At the other end of it, if a man is having 1 or less nocturnal erections, it's kind of a relief for their partner to know that they're not the problem. The man has a vascular disease or some other condition that's affecting him. We can also assess premature ejaculation. So premature ejaculation is, the definitions vary, but it's usually having a climax within 3 minutes of penetration. Mm-hmm. Well, we don't really know what's normal. So what's normal for a man my age is going to be very different from a man who's 20. There are a lot of young men out there, and people blame this on porn, who have and their partners will too, regard them as as subperforming if they orgasm quickly. But that's actually probably quite normal at that age, and we can start to document that. But we can also
there's 2 functions though that go on with this device, which is the first one is on an individual level. It can really help to kind of determine around erections. If a man is getting erections at night but not during the day, that would indicate, not necessarily for sure, but would indicate something more in the psychological, relational realm. Whereas if erections are not happening at the rate to be expected for the man's age and health, that may indicate health issues. But it sounds like with PE, you're talking a little bit more about large scale data collection by being able to assess for men in a certain age range. If there's enough people utilizing a device like this, we could actually get a lot more data about what is normal and what are the normal ranges to be expected at various ages.
That's correct. Now, for a young man, say I'm 25 years old, to not be able to get it up with someone and to say, gee, and to panic or be concerned appropriately. And I will say that as an emergency physician, there are a few emergencies other than heart attack or stroke that alarm men as much as erectile dysfunction. But young men to go online and say, gee, I'm going to get some pills and I'll see what happens. But for a man your age or my age, Mark, to do that, they're making a mistake, because the urologist and the cardiologist describe the penis as the canary in the coal mine of vascular disease.
Mm-hmm.
What else? So what else could we assess? So, I mean, I also want to reiterate, for a man my age to go online and get pills, if they're not performing, that's a mistake. They need an evaluation. So our device can tell people when they need to seek medical help. So what are the, we call them the cock killers. Well, there are medications that are taken commonly: SSRI, antidepressants, blood pressure medications, anti-anxiety medications, sleep medications, all of which have a significant impact on the quality of erections. And men utilizing our device have been able to change their medications in order to perform better. I mean, Mark, people like you and I are part of the problem. I'm 69 years old. I've never had a doctor ask me about my sexual health. They've never discussed the impact of a medication, the impact of a disease. And for speaking to my men my age, people younger than me, doctors don't ask. And that's we're part of the problem. We're not alerting people to, here's this really important area of their life, and we're not alerting people or evaluating with them.
Yep. That's a big part of what we're trying to do on the podcast is make this topic discussable, make people, more comfortable to be able to bring this up, both from the provider to the patient, but also the patient to the provider. So I definitely get the importance of that. Now, we're talking about the device. I did want to see if you could give our listeners a little bit of a brief history or overview of what used to be called or referred to as the stamp test, and maybe help them understand how this device in many ways replaces a pseudo to not exact science at best.
Right. Well, in the past, there were only two ways of objectively looking at erections. So before the first was a stamp test. Basically, men would be told to put a ring of stamps around their penis, lightly moisten them, so that they wouldn't be, the stamps would not be that adherent to their penis. And if they woke up in the morning and the stamps were broken open, then they had a nocturnal erection. Well, we know that having one nocturnal erection ain't no big deal, frankly. A man who only has one nocturnal erection could still have significant diabetes, hypertension, or problems with alcohol and other causes of erectile dysfunction. Then there was also a device that was popular until through the 1980s called the Rigiscan. The Rigiscan looks like something Dr. Frankenstein would put on your penis. It has these two big rings. It's attached. It's not Bluetooth enabled the way everything is today. It's connected by wires to a box. The box itself, the diagnostic box, costs several $1,000s. Most men would have to go to a sleep lab in order to do this, so they could potentially do it at home. But the Rigiscan could not be worn during sex to evaluate performance during sex, and it's so bulky and awkward it could also interfere with sleep, as opposed to the type of more natural sleep that people have in their own bed, at home. Mm-hmm. So until this came along, there really was no way of objectively evaluating one's, I call it erectile health, because before there's dysfunction, there's erectile fitness, and we and our partners all want us to maintain fitness for a lifetime of lovemaking. With data, it's possible to say, "Hey, I'm healthy. Here's my score, and I'm healthy. I need to maintain this." Just the way one would with a blood pressure or electrocardiogram or a blood test. On the hand, if one has a problem, one can then say, "Well, I don't want things to deteriorate from this point. What can I do to hold myself at this level?" So, as a sex therapist,
I just want to emphasize to our listeners the importance of a device like this, because we don't really have an ability to really diagnose psychogenic erectile dysfunction. Now, I know that again, it isn't a 100% for sure guarantee, but it's a pretty good indicator if a man is getting nocturnal erections and not getting daytime erections. And it really is from my perspective, a bit of a breakthrough and a really helpful kind of tool to have that kind of data, because erectile dysfunction is so complex and it's hard to tease out what some of the causes are or what might be driving it. And when you can see the data and you can see that you're getting erections at night, but it's not happening during the day, that really can help to kind of steer or guide some of these men toward appropriate treatment. So I think this is a really, really powerful device. Now, can you let our listeners in on a little bit of what are some of the specific measures or outcomes that a person who's using this device should be expecting to see?
Well, we now have over 1,500 data sets. And ideally, of course, to your point earlier, we'd like to have small tens of thousands, because then we can really provide people with comparative data. But I'll address this first by talking about myself. I am 69. I have high blood pressure that's controlled with a medication called losartan. My blood pressure will fluctuate between a normal range, and then it might go up to 140, 150. What does that mean? I have no idea. When it comes to blood pressure, we're concerned about the impact on the brain, the heart, and the kidneys, and the blood pressure is not telling me anything about those things specifically. With this device, I average 3+ to 4+ nocturnal erections per night. When I see that, it's like going to my internist and having an internist tell me, "Hey, your EKG and your stress test are normal." It's because the number of nocturnal erections is a more sensitive indicator of vascular disease than your blood pressure. We've had young men who are bodybuilders who are having only one nocturnal erection per night. They wonder why they can't get it up. Well, they're taking cocktail of medications, testosterone, and other steroids and hormones that are having an impact. And we've had several young men change their regimen and recover a significant number of nocturnal erections.
What do the users actually see, though? Where do they get that data?
Sure. The device is Bluetooth enabled. It's cyber secured. The data is when people end a session of sex or an overnight session, they upload the data. The data goes to the cloud, and people can then download the data. They can share with a doctor, they can share with friends, or they can just evaluate themselves. And they'll see the following. They'll see their firmness. Everyone has a personal best. So, my personal best is normal. I don't have erectile dysfunction, but we have men who have diabetes or hypertension, or other erectile dysfunction. So their best erection will be recorded as their personal best. If they fall below that or they go above it, they'll receive a notification from us, or they'll see it themselves that they're either underperforming or overperforming. We're also measuring the duration of the erection, and that's impacted by diseases, medications, recreational drugs, alcohol, relationship issues, et cetera. We also, and they'll see that on a graph. Below the graph, they will see a count of the number of nocturnal erections that they're having and the duration of those nocturnal erections. Interestingly, but we need more data to confirm this, and many people are unaware of this, but every episode of REM sleep, high quality sleep, so to speak, is accompanied by an erection in a man who is in normal health. Obviously, if someone taking a screen, someone's castrated, or someone they're not, that's not going to apply. But in general, that will apply. So for myself, it's been interesting, and we document this now in this little small internal study of 12 people, that the amount of the duration, cumulative duration of our nocturnal erections is about what we would expect to have for REM sleep. So a man my age should have about 75 to 80 minutes of REM sleep, and my nocturnal erections are running about 10 minutes less than that. So we think that this may well be another approximator, or certainly a complementary approximator to the data that people are getting off their Apple Watches or their Oura Rings or their Whoop Rings.
In other words, you're saying one of the applications is also an additional assessor of sleep quality.
Correct.
Okay.
I'll speak about myself and several other of the older people who use the device. I have deliberately taken, I don't usually take sleep medication, but I've taken Ambien twice because I'm interested in what's the impact on my nocturnal erections. zero nocturnal erections.
That is fast.
I took trazodone, and we had another person in this internal study who took young person to trazodone 3 nights in a row. No nocturnal. Well, the nocturnal erections were below our threshold. We see them, but they're below our threshold for declaring them. The threshold was determined by our advisory group of urologists. The threshold that they determined was 40% of a full erection for that person. So I don't want to get too much into the weeds here, but my point is, you and I both know that there are millions of people taking sleep medications every night. Now you sleep, but the quality of your sleep is poor, and our device is documenting that poor quality. Alcohol seems to, and by alcohol I don't mean a glass of wine.
Inebriated.
Inebriated, correct. I mean 3 glasses of wine or more than 2 cocktails. The more you drink, the duration, your firmness and duration of nocturnal erections goes down significantly. Well, that's not that important necessarily in someone who's young, but in someone who's old, men need to get blood into their penis at night. That's the purpose of nocturnal erections. I mean, if it really is a use it or lose it phenomena.
Yeah, and there's so many potential applications that can be analyzed through this device, and I do think that men who are serious, not just about addressing erectile dysfunction, but are serious about erection health and do have some concerns, have a family history and whatnot, or just want to learn more about what seems to impact them or how their body works around this. It sounds like this device could be a tremendously helpful tool, not just as a one-time diagnostic tool, but this could be like ongoing data collection information about how things are working down there.
That's correct. I mean, for a young person, well, I'll put it this way. I think just the way, if you or I went to an internist or cardiologist at our age, Mark, and they didn't check your blood pressure, they didn't get an electrocardiogram, we would think, what using a stethoscope? Really? I mean, this is 2020, 2022. So I am confident that within the next 3 to 5 years, this will be a standard of care for men who are over 45 or 50 years of age. The use of technology of this sort. It might not be our device, might be someone else's device, but technology that can tell men about the nocturnal erections, the duration of the erections, the firmness of the erections. This will become a standard of care in evaluating men, older men especially.
Yes. So to that end, because I think that wearable technology is certainly, it's not even just the wave of the future, it's here. Like you pointed out, we've got watches. Many people walk around with all kinds of, Fitbit devices and whatnot, collecting data, learning more about themselves. So I do think that this certainly is, the way that things are going to be, and probably the way that we're going to manage a lot of our own healthcare moving forward. So one of the questions that I have to imagine our listeners are going to be interested in is, is this device comfortable? Is this uncomfortable? How does this thing sit? Do guys notice it? Do they not notice it?
Well, if you notice it, it's usually the first time. I don't wear underwear when I sleep. If you told me to put on a pair of underwear, I would notice it. This device, most cock rings are made out of silicone, which is uncomfortable. Silicone makes you adapt to it. Most cock rings can't be worn more than 20, 30 minutes as a consequence, unless there be strangulation effect. This cock ring was designed to be worn overnight comfortably. It's made out of a soft elastomer. It's adjustable. It has a safety feature, which is it closes with a latch, as opposed to being something that needs to be slid on and off with, which can be quite difficult. It was designed also to not block the arterial flow into the penis, so that it could be put on when men are flaccid, but only to constrain the venous outflow from the penis, and that constraint is only about 50%. So it's safe. There's no risk of strangulation effect with this or priapism.
And I guess lastly, we've sold over 500. We've had 3 complaints about discomfort. They all involve men saying it's pulling on my pubic hair. Well, as an emergency physician, my idea of discomfort is I'm going to stick a needle in your eyeball. Pulling on the pubic hair ranks fairly low among emergency physicians as a source of discomfort. And people, we just tell people,
sweep the hair out of the way. After you put it on, pull the hair out of the way. Or if you want, if necessary, shave. But we have not had any significant complaints of.
Okay, that's really important to hear. Now, do partners, because you mentioned that this could be used during sexual activity or just to assess nocturnal erections, do partners notice this device? Has there been any feedback about this interfering with partners' sexual activity in any way?
No, partners like it. Men have 95% of our users report in a study, again, 40 men, 95% reported longer erections. In addition to which, our device, most, I don't know about the familiarity that you have, Mark, with cock rings, but usually after a man climaxes, I'll speak my own experience, you want it off right away because it hurts. It's uncomfortable. It pinches. Now, men will put up with discomfort to have an erection. Mm-hmm. Men would probably put up with being stabbed in the back while having intercourse if they're actively having intercourse. So this device is 75% of men report better orgasms. So the women partners enjoy it because the erection lasts longer. Most men enjoy it because their orgasms are better. Women also report our device is covered with a soft elastomer. So we have had positive comments from women because it's unlike rubbing against hard silicone with a cock ring, but now something soft for them to rub the clitoris against.
Okay, so you're saying all in all, it seems to be that the feedback so far from the users is that it seems to be a net positive. Users report that this is comfortable, and it sounds like very quickly for many of these users, it becomes unnoticeable. It just becomes something that's there, and they can wear it for like the duration of an evening or overnight without really much interference.
We have men report to us that after the first 2 or 3 times, they'll wake up with it in the morning and they don't even know, they forget. They go to the bathroom. They go to the bathroom to urinate. They go, oh, it's still on. I got to take it off.
Yeah. So this is a really fascinating area, which I think is going to become crucial in the diagnostics of erectile dysfunction. I know that you mentioned that it could be standard of care for 45 and 50-year-old men, but I definitely can see a utility for younger patients who are not really sure or who just need the reassurance that their body is doing what it's supposed to do. And really kind of being able to take that next step toward the relational or psychological treatment to really kind of get to the bottom or the root of their ED.
Yeah, I mean, looking at our database of younger men, they're utilizing it for several purposes, the data for several purposes. One, we've had several men who want to take finasteride for hair loss, but they've read online, and people, get symptoms often when they read about something. They've read online that finasteride can cause impotence. And they've used our device to show, oh no, I still have the same number of nocturnal erections. I'm still just as hard. If I'm masturbating, having sex, I'm just as hard or firm as I was before. I don't have to worry about the finasteride. We've had younger bodybuilders, as I said before, use this to adjust the amount of testosterone or steroids that that they're taking. We've also had young men who are taking Viagra or sildenafil or tadalafil. Say, well, are these things making any difference? And they've discovered that no, they're not making any difference. They might be having a placebo benefit, but they're not having an impact. So why am I spending the money on these medications? Yeah,
and I just think it's so powerful to have that biofeedback because there is so many hours and just brain power that goes into thinking and overthinking. What's causing my ED? What is it? Elimination this, elimination that. And having that feedback really could alleviate a lot of the worry, a lot of the distress, a lot of the overthinking by having that really clear data. So I am really excited about this device. I see a tremendous amount of utility. Certainly for our listeners who are invested in trying to really resolve their erectile dysfunction, this really could be a tool that helps at least answer some of the complexity or some of the puzzle. This has been really informative for myself. I really think our listeners are going to benefit from hearing this interview. Would it be okay if we leave a link to, how to learn more about this device, or, how to go about contacting the company if people are interested in.
Certainly, I appreciate that. We talk about wearables. My perspective, we call this the world's first underwearable. I'm certainly will be more underwearables. My wife calls it a dick bit because it's like a Fitbit, only for the penis. So we'd love to be linked.
Okay, so we're going to definitely go ahead and add that. And again, once again, thank you very much for your time and for sharing your knowledge with us. And we'll look forward to hosting you for another episode in the future.
Thanks for the opportunity, Mark. This is a pleasure.